Down syndrome is a condition which is known globally. It was first found to be present in children way back in the 19th century. But it took years before the cause could be detected. It was in 1959 that it was determined that Down syndrome occurs due to a genetic problem in chromosome 21. And this is something which occurs naturally. It's by chance that it occurs, that the chromosomes, when they divide, they do not divide correctly, and therefore there is an extra chromosome which comes into these children. And therefore it is called trisomy 21, wherein 21 is the chromosome number which gets affected, and trisomy means there are 3 chromosomes instead of 2. So in short, Down syndrome has been well recognized, and today, since 2006, we have been talking about it, and in 2011 it was first brought to the attention of the United Nations, and we have started celebrating or talking about World Downs Day. The question is, what really goes wrong with Down syndrome? What really happens to the baby? The baby is born normally, but with quite a bit of mental disability and physical disabilities could exist. But the child has a lifespan which is not complete, and there's quite a bit of morbidity which occurs as the child grows. So in short, this is a condition which is well established, and now with the latest advances in technology, we have been able to diagnose it much before the child is born. There's nothing we can do to prevent it, because it is shown that in younger women, it occurs in about 1 out of 1,000 women. Whilst in women who are above the age of 45 years, there will be almost 30 women out of 1,000 who will have a child with Down syndrome. So history taking is extremely important. What age is the patient at, and then decide the risk. But that does not mean younger patients cannot have Down syndrome. And I think the message I want to bring down on this day, on the day of World Down syndrome, is to say that let's prevent the birth of these children. And that is possible today by doing various tests. We can do blood test, we can do ultrasound, and we can do invasive test, wherein we can then confirm whether the child is affected or not. The invasive test, that means we take some fluid, amniotic fluid from the uterus and test it to check the chromosomes, or we take a chorion villus sampling, which is done at about 10 weeks of pregnancy, in the first 3 months of pregnancy, and it could be detected even at that time. But these are invasive processes, and therefore there is a risk of miscarriage. On the other hand, there is a new test now which is called the cell-free DNA test, wherein you pick up the DNA of the baby from the mother's blood and test that DNA and give a report, which is almost 99.5% correct. But though the amniocentesis is the 100% accurate test. Blood tests give us a specificity, almost a sensitivity of almost 95%. So on an average, you can go wrong with 5% if you do only the blood test. So I think it's important for us to remember that this test can be offered to every pregnant woman in order to prevent the birth of Down syndrome babies, so that children have a better quality of life.